Thank you, Lenny. It is great to be with all of you this morning. I want to thank all the co-hosts that helped convene today's summit. Montgomery County Department of Health and Human Services, the Women's Coalition, the Primary Care Coalition, and others gathered here today. I'm really pleased to be here with my colleague, George Leventhal from the Montgomery County Council, who's done a terrific job on health care issues and primary health care issues. Let's give George a big round of applause this morning. And to Uma Alawalia, our terrific director of the Department of Health and Human Services here in Montgomery County. Thank you very much as well for really working so hard in this area and, of course, for becoming the point organization here in the Capital Region for making this work. And I know everyone recognizes very fully that the Health Connector has had a rocky start. There's no sugarcoating it, but we will succeed in terms of making this work, and it will help succeed because of your efforts. I do think it's important just to remind people that the Affordable Care Act was in place well before October 1st and was providing very important benefits and consumer and patient protections well before October 1st. And I do want to just provide a few, I think, important statistics from just Maryland's 8th Congressional District. So this is not the country, this is not the state, this is Montgomery County's 8th Congressional District. And as a result of the Affordable Care Act, approximately 5,000 young people are now able to participate on their parents' health insurance policies. So these are people who would have not been covered up to about the age of 26. They're now covered. About 6,000 seniors in the 8th Congressional District are benefiting from the fact that they're no longer falling into what was the prescription drug donut hole, where seniors on Medicare would have a lot of out-of-pocket costs and then all of a sudden find themselves not being able to make ends meet. And so because of the changes in the Affordable Care Act, 6,000 seniors in the 8th Congressional District are no longer suffering through the donut hole. 93,000 seniors in the 8th Congressional District are benefiting from the fact that for preventive coverage, preventive care services under Medicare, there are no co-pays, and so that has encouraged more people to get needed preventive care. 40,000 children in Maryland cannot be denied access to health care for pre-existing conditions. All of us know that when these exchanges fully kick in, that will be true of anybody, whether you're young, middle-aged, or old. But the part of the law that affected kids went into effect very early, and as a result of that, in the 8th Congressional District, 40,000 kids had access to health insurance despite the earlier restrictions on kids with pre-existing conditions. And then there are a whole number of other provisions. Over 200,000 people in the 8th Congressional District are benefiting from the provisions that say that insurance companies have to spend a certain percentage of the premium on providing health care as opposed to administration and overhead. And that has meant more affordable care for over 200,000 8th Congressional District residents. So I do think it's important to remind people that all those provisions were already in place and operating before October 1st. And that's just a little snapshot of how it's helping one congressional district in one state in the country. Now, obviously, we're all embarked on trying to make sure we open up these marketplaces and exchanges. And there's the good news and the bad news. I mean, the good news, at least with respect to demonstrating the importance of the law, is that so many people have tried to access it. I mean, there's a big demand. I mean, that means that there are millions of people in the United States of America who do not have affordable health care, who are in many cases going day to day, rolling the dice, and risking the possibility that if they get sick, that they will be economically devastated because they couldn't afford it. And you have 20 million people in the country who have gone on to the national websites And here in the state of Maryland, you've got over 300,000 unique visitors to those sites. So people are hungry for the product. The big issue, of course, is making sure that we improve the systems, both in terms of the websites as well as the paper systems, to allow people to access these products that they need. And of course, in order to make sure that these products are affordable, we need to encourage people of all ages to sign up. And that's why the folks in this room are so important, because we've got to make sure that this system gets up and running. And in the meantime, while the folks who know the technology are doing their job, we've got to make sure that we engage with the Marylanders who are trying to access the system, do our best to keep them up to date and informed about the current status of the system. And I'm sure there'll be many recommendations today as to how best to do that. Because one thing we want to make sure does not happen, we don't want people who have difficulty accessing the system now to lose heart and to lose faith and not come back to get something that they need and are trying to access right now. And so that's why it's so important that we be fully engaged and explain to people what the status of the system is and what steps they can do and take now, what steps they can take now to put themselves in the best position possible when things are running more smoothly. So look, as the President has said with respect to the national efforts, as Governor O'Malley has indicated here in the state of Maryland, this launch did not go as people had planned for and hoped, but the demand is there. And I will just close by making the point that just a couple days ago we were going through a number of clips, newspaper clips and headlines from the time that the prescription drug Part D was launched. And I'll tell you, it took them many, many weeks to get that system up and running, and that, of course, was not as large a system. And if you look at the headlines from that period of time, around 2004, 2005 time period, it was, glitches mar rollout of prescription drug sign-up, seniors having difficulty accessing the system. And guess what? They ended up working out the problems, and that became a very popular benefit and coverage under Medicare Part D. And that was in a situation, an environment, frankly, where everybody was actually working together to try and get people signed up. I mean, whether you were in favor of the law as it passed, and there were different versions of proposed laws, but once that law passed, Democrats and Republicans, independents worked together to make it work. We obviously have a very different circumstance in this case. You still have lots of people who are trying to prevent this law from happening. So that obviously provides additional headwinds, not here in the state of Maryland, but across the country in many other states. But we're going to persevere, and we're going to get it done. We're going to get it done around the country, and all of you are going to make sure that we get it done here in the state of Maryland, because people are counting on all of you to make sure that they can get affordable care in our state. Let's get it done. Let's do it for them. Thank you all very much for being here and for doing it.